You're listening to C103's Cork Today podcast. Phone and text lines are currently closed.
We're off to the Health Hub store, Times Square in Ballincollig, where Anneliese joins me. Good afternoon, Anneliese.
Good afternoon, Patricia.
And you're very welcome. And I want to start with a really lovely text that Anne, one of your customers, sent in earlier to say, "Hi, Patricia, I heard you referencing GPs and how expensive it can be to go to the GP. Well, I look forward to Anneliese every Monday, as myself and my husband called into her store 2 weeks ago, and whatever anxieties you had going in, Anneliese's serene, calm, gentle approach alone banished all the butterflies. She gave us her time, her listening ear, her genuine concern and her exceptional expertise, and she is so knowledgeable. A lot of ailments can be addressed naturally. Whilst we do and will always need the medical profession, we should try the alternative routes as well." And that's from somebody called Anne.
Well, that's very, very kind. And actually, I do agree, Patricia, that if we could incorporate the natural approach, we could take a lot of pressure off our hospitals. It's not that it should be followed alone. I'm always very suspect of anyone who says don't take medicines, because there's amazing medicines out there, you know. So, but it would be lovely if there was a combined approach, because we could prevent people from getting to the stage where they were so unwell they needed that type of help.
Yeah, they should just complement each other.
Yeah, they should, exactly.
Yeah. Okay, straight into questions. Hi, Anneliese, I'm 32 and have been diagnosed with endometriosis. I had surgery recently to lessen the effects of the pain, etc. But I'm still in pain and still a lot of discomfort. I'm wondering any supplements that might help me out. God, endometriosis is such a painful condition.
It is, and it can be very severe for people, Patricia. And over the years, I've seen people who actually nearly need to spend 2 weeks every month in bed with such severe pain. And it is a fairly complex health issue, because there's definitely more than one causative factor at play, I think. So for people who don't know what it is, endometriosis is where the tissue of the womb grows outside the womb. And then during your monthly cycle, it responds to the hormones. Coming to the end of your cycle, it bleeds like the womb tissue bleeds. Normally the womb tissue will slough off, and that's what your menstrual cycle is. But when it's trapped in the outside the womb, that just causes a huge amount of inflammation and pain. And over time, scar tissue can develop. It's very common that the bowel actually would become stuck. The ovaries can become stuck. So then you've got terrible bowel pain as well. So it really is. It's not a nice condition to have. And often, a lot of the time, it's dealt with by putting young girls on the pill. So by the time they come to the age of wanting to have children, it's just put it off for a time where it's going to be harder to get pregnant, and they're going to be even in more pain. So address it at the root cause. What do you need to do? So the first thing really is to follow a very strict sugar-free diet, because it's like polycystic ovaries. Insulin, the hormone that is released when we eat sugar, has a big part to play in getting the whole hormone kind of imbalance sorted out. So following a low sugar diet, a no sugar diet, and a low carb diet for a lot of people can help. Some people actually will do very well on a vegan diet, Patricia, that they can't tolerate red meat. So you have two options there, and you need to follow the one that you find works for you. Then hormone balance is really important. So always with hormones, you're looking at liver support, and you need something like a very strong hormone liver detoxifier, like there's one called DIM, D-I-M, Di-indole Methane, and that supports the sulfation pathway, whereby you detoxify estrogen, and it's the estrogen, really estrogenic hormone is the very inflammatory one for endometriosis. So that is great for the liver. Taking fish oils for a lot of people solves the problem. And I've started doing an awful lot of research now on the black cumin oil, because so many people started coming in looking for it. I've been interested in it for a while. But it is a lovely one, because not only have you got the powerful omega-3s in it, but there are obviously other plant-based chemicals in that seed that are really powerful natural anti-inflammatories, and I've been recommending it as well for actually people who have eczema. So black cumin oil or fish oils are very good as natural anti-inflammatories. And then for hormone balance, you're looking at things like agnus, castus, vitamin B6 high dose. All the B vitamins are very good. Magnesium can help hugely with the pain. So a combination of all of those can work wonderfully with the diet. And I've had people who go pain-free and have managed to get pregnant, no problem down the road. But you have to follow it. And I'd definitely advise getting a nutritional therapist to help you.
Yeah, okay, good luck with that. Bernice is in the city. Says, could you ask Anneliese, does she know is clove oil readily available? I was in my pharmacist with severe toothache and the pharmacist recommended buying clove oil.
Yeah, it's fantastic for toothache. And also the other lovely thing about it as well is it's a very powerful natural antibiotic. So if you've got an infection, it's great. Especially if you have to wait a while before you can go to the doctor. A lot of the time they won't treat it until the infection is gone. So you should get it in any health shop. It's what they call an essential oil. We have it here all the time. Actually, I love it in the house as well. I burn it sometimes.
Love the smell, yeah.
Yeah, I love the smell of it. So you'll get it in any good health shop.
Okay, somebody is looking for advice. A 26-year-old who sweats a lot to the point of clothes getting wet, eats very healthily. What causes somebody to sweat a lot?
Hyperhidrosis, that's called, Patricia, but there's unfortunately nothing really for it. I think it's just it is just the way your body works. Definitely if it was an older person, I'd be thinking of hormone reasons. Now, if the sweat is very smelly, I would talk about liver support, but if it's just fresh sweat, unfortunately, that's just the problem of having that type of body. Now, there are things that you can do not naturally, but if it's from the feet or the hands or the armpits, I would definitely recommend Botox because they paralyze those sweat glands and it can give people fantastic results. So that's probably the best way to go for that.
Okay, any advice for a 14-year-old daughter? Ongoing catarrh, itchy nose and a cough. Now, she's tried antihistamines. The GP put her on a nasal steroid nose spray, but they haven't helped.
Okay, so I'm not sure now. It's ongoing, but I'm not sure so for how long. So is it, a lot of people after COVID as well, Patricia, got a lot of respiratory conditions that were very difficult to shift. So if it's definitely coming from the chest, I would suggest something like the Dr. Delish Clare Mucotone is fantastic. And then olive leaf extract for the immune system, which is also one of my top favourite products in the shop. And you could even try it for a couple of weeks to see was there any benefit. But if it's been going on for longer, I often then would suspect a food intolerance or an environmental intolerance. So the food intolerance you can test. Generally, people with food intolerance and catarrh, dairy is a big factor there. So you might want to, even before you do a test, try a dairy-free diet for a little while. But when I do the tests here myself, Patricia, what comes up most commonly are dairy and egg for everybody. So definitely look at those in the diet. That's probably the best suggestion I could give as well. Then in terms of if it's worse in the wintertime, it's more like a mould, possibly, and then getting an air purifier into the house would help. But if it's worse in the summertime, then there might be some link with pollen and dust and things like that. So taking a natural antihistamine like CurcuDyn can work really, really well. You'll get it in a health shop.
Okay, question for Anneliese. I am in my 40s. I thought I was going through the menopause. I'm taking perimeno tablets. But since the start of this year, my periods came back and they're back every month, where prior I hadn't had one. I was only getting one every 6 months. What's going on? It's the way it can go, isn't it, for some people?
It's the way it can go. And actually, I wonder, is it even anything to do with the tablets? The tablets, like a lot of these menopause supports, have got plant-based estrogens in there, which are very mild, but it's like a plant-style HRT. And maybe it's just propped up your own fluctuating levels enough to actually restart your cycle. I know that a lot of people, when they go on HRT, a period might come. But the truth of it is, Patricia, I don't understand why doctors won't give women HRT when they're still getting their periods if they've all the symptoms of menopause, because you want to take it for the symptoms, not, for any other reason. I think doctors often think that it's good to take because of the osteoporosis factor, but actually for an awful lot of us, really, it's about taking it just for peace of mind and for good night's sleep and to be able to get through our days. So for this lady, if she really doesn't want her periods, maybe she should stop taking the supplement for a little bit, see how her hormones go, if they go back to normal. And if she gets her symptoms back again, I would think that there's no harm staying on that supplement, but she'll just have to put up with having a period.
Okay, what would you recommend for a child who suffers from mouth ulcers?
So what I always recommend is firstly change the toothpaste to one without sodium lauryl sulfate, which is a foaming agent a lot of people are allergic to. So you'll get a natural toothpaste in the health store. You can get them with fluoride if you're worried about that. Change to that. And then use something like colloidal silver to deal with the pain. You can get it in spray form and spray it on. It just keeps them from getting infected, and it can help them heal an awful lot quicker. And maybe if their diet is poor, take a vitamin C and zinc supplement, because that's really important for wound healing.
Okay, and hi Anneliese, this is somebody obviously at the moment suffering from a very sore throat, yellow spots on the throat, finding it very hard to swallow. What can I take to help relieve it?
Well, I think at this point, yellow spots on the throat definitely probably need an antibiotic of some sort. So you could gargle with salt and water. You can get lozenges, Patricia, in the pharmacy, and maybe even a spray that has a little bit of lidocaine in it that might take the pain out. But in terms of eating, get yourself some lovely soup and smoothies, and just make sure you're getting the nutrition into you to keep your immune system boosted. I find that gargling with the grapefruit seed extract is great for a sore throat because it kills off the bacteria. But I think if there's white spots, it might be a little bit deeper than just that alone.
Yeah, it may need an antibiotic.
I think so. Yellow spots do not sound good.
No. Hi, Anneliese. Is it okay to take different types of vitamins at the same time? And do you have to be careful about taking vitamins with other medication?
Definitely. Yes, you do. Certain natural supplements will interfere with medications. For example, a blood thinner is nearly always the worst one. Lots of things will thin the blood, like turmeric, for example, and coenzyme Q10 and fish oils. So the danger, I suppose, is that your blood could become too thin. Now, I always think, why wouldn't you just reduce the medication? But I think it's more complicated for doctors to manage that, whereas they know dose-dependent how much of a blood thinner to give to someone. So I understand that. But that would be the main one. Other ones, I nearly always just suggest, Patricia, to be on the safe side, take natural remedies away from taking a medication, and always tell the health shop what you're taking medication-wise, because we'd often be able to say to people, oh no, you shouldn't take that. Also, one of the things about natural remedies is that it might speed up detoxification of medication through the liver, which means that you're not getting enough dose strength out to come through the liver at the other end, because the liver is removing it too efficiently. So that might affect the way your medication is working for you. But if you wait 2 hours, it should be perfectly safe. Okay,
and a final one, any recommendation for somebody with itchy feet? Ooh.
Okay, so the first thing there I would think is something maybe like athlete's foot, which is a fungal infection. You would get itchy feet. You possibly might even have peeling skin. So the best natural remedy for that is the grapefruit seed extract. Again, I spoke of it there as a spray for the throat. Actually, I also should have mentioned for the throat, Patricia, Delish Claire, of course, her throat spray is fantastic. And also Irish Botanica do a great throat coat. So they will definitely help with the pain. So for the feet, do a foot bath with the grapefruit seed extract. Put about 10 or 15 drops into some warm water and soak them, and then keep putting it on morning and evening. Rub it on with a cotton ball. And if that doesn't fix the itching issue, sometimes people would talk about itchy feet, Patricia, like hot feet, and that might be a magnesium issue, especially if it comes along with restless legs. So maybe take a supplement with magnesium in it, and that's more of a kind of a skin crawly as a feeling as opposed to a skin itch. So that would be the second thing I'd try.
Okay, mind of information as always. Have a lovely week. We'll chat next Monday.
Patricia.
Thanks. That's Anneliese of the Health Hub, Times Square in Ballincollig.